My name is Cassie Music. I'm the Vice President of Healthcare Operations at Isaiah House. I'm a nurse practitioner and I've been with Isaiah House for almost 6 years. Bringing your family member into treatment, I'm sure, is a roller coaster of emotions. Speaking from a mom myself, I can't imagine having to drop my child off at treatment, but you can rest assured that we have numerous medical staff members across all of our treatment centers that are perfectly trained to take care of your family member. And if at any time, like I said, that we don't feel we're the appropriate place for them, we will get them to a higher level of care, and we will always communicate that to you. The medications that a client can take while they are in treatment varies greatly for each person. We try to do individualized treatment plans for each person, so everything that somebody can take is a little different. What we ask that you do is at least tell the admissions team what you're taking, and then we will evaluate you on a needed basis. We do want you to bring all of those medications in with you so that we can see what you've been prescribed. We can't fill certain medications until they're due at your pharmacy. We do want you to bring all of your medications in with you. There are certain medications that we are not able to fill until certain dates, such as controlled substances. We will use our pharmacy that we utilize to fill those next prescriptions, but we do want you to bring all of those in so that we can see what you're taking. Most medications you'll be able to continue while at Isaiah House. Blood pressure medicines, diabetic medications, depression meds, most of those you're going to be able to continue. We do look a little closely at controlled substances, and we do those on an individualized basis. So if you take something at home, we're not necessarily going to stop it. We just look at your overall picture and see if it's something that we can continue while in our treatment program. There are a few medications that we use for medication-assisted treatment. Those medications include Vivitrol, Sublocade, Suboxone. Vivitrol is a once a month, every 28-day intramuscular injection. And that medication just helps with opiate cravings. It blocks the effect of opiates if a person was to try to use an opiate. It's a really successful medication that most of our clients utilize. We also offer Suboxone. We use this for withdrawal management services as well as maintenance for those individuals after a provider deems that appropriate. Sublocade is a once a month injection that also we utilize. This medication goes into the abdominal fat. We can transition people to Sublocade from Suboxone if they are interested. We do encourage this if going into our long-term program or any of our sober living homes. We do encourage clients to transition to Sublocade if they're going into our long-term program or any of our sober living homes. We have an abundance of medical services while you're in treatment at Isaiah House. We do have nurse practitioners on site that can be seen on an as-needed basis. We also have many nurses at each site so that you can be evaluated if needed. At Isaiah House, we offer many primary care services such as controlling diabetes, hypertension. We help prescribe medications for depression, anxiety. We have nurse practitioners on site that can help with the prescribing of those medications and help monitor the progress of those disease states while you're in treatment with us. When a client comes in acute withdrawal, there are many things that we offer and do for a client to help ease that process a little bit. You will be monitored by our medical staff. You'll be provided medications that's appropriate for what your need is. If at any time we feel that we are not the appropriate place for you, we will triage that person to a higher level of care, such as a hospital. We do work with local hospitals to get you back to our treatment center, so it's not like we're just sending you out and not going to bring you back. We will always bring you back as long as it's medically appropriate for our center. Along with the withdrawal management services, as I said, you will be monitored by medical staff. Clients are allowed to rest for a period of several days. If our medical staff feels it's appropriate that you keep resting, then we will allow clients to continue on bed rests. We want to make sure that you're staying hydrated by providing you Gatorades, water, whatever that is that's needed. In addition, we also have the medications that we use. These can be ranging from over-the-counter medications to prescription meds to things like Suboxone as well. We do ask that you don't bring over-the-counter medications in with you. We will order you unopened medications from our pharmacy. So you do have access to things such as Tylenol, ibuprofen, Claritin, Zyrtec, whatever you may take at home that's over-the-counter. We just ask that you don't bring those into our facility. We will order you brand new unopened medications.